Doctor, I just have a follow-up on what you mentioned about integrating public and private. Earlier you mentioned that the next stage of the integration will be the healthcare, the human resources that will be moved from different hospitals and the training and all that, and having private hospitals actually, keep their patients where they are. When will this be actually implemented?
We are looking into coordinating the public and the private sector. So, COVID-19 Assessment Center, I think we're going to form a COVID-19 Assessment Center. All cases will be assessed in a COVID-19 Assessment Center. And as I said, once they've been assessed, whether, for example, low-risk group, young patient can be actually monitored at home. So then we will look into how we can monitor at home using MySejahtera, and we rope in the general practitioners as well to assist Ministry of Health to look into how we monitor patient at home. But a low-risk group, for example, Category 1 and Category 2, but high in terms of high risk in terms of age and of comorbidities, then we need to admit them. So we will designate which hospital or PKRC they will be placed. So I think that is where we try to coordinate in terms of implementation. And not only for the COVID patient, we are also looking into the hemodialysis. So there will be a one-stop center looking at hemodialysis, because most cases of hemodialysis patients will be dialyzed in the private and the public sector and private sector. So now the coordination is important. For example, in Tawau, there was one occasion in the private hemodialysis center, the staff have been infected or even been quarantined. But the services need to continue, otherwise the patient do not have access to hemodialysis. So we in the public sector send our staff to run the services. So now we are looking into coordinating in terms of the public sector and the private sector coming together as one to look into how we can resolve some of the issues. So we hope that when we set up the COVID-19 Assessment Center, and there will be some group of patients, for example, can be managed in the private sector. For example, if they are expatriate, today expatriate or staff from the embassy, for example, we have already identified 2 hospitals for them. That is actually PPUM and PPUKM. Now, if you look into the capacity of PPUM and PPUKM, already almost 100%. So what option do they have? So this is where we can actually refer to a private hospital, designated private hospital, who has the capacity to treat Category 3, 4, and 5. So I think this is where we need to coordinate and make sure that we have a smooth coordination and referral in terms of from patient to and monitoring of the cases. So this is what we are trying to do. Hopefully by a week, next week, we can actually start this Saturday, start the COVID-19 Assessment Center and start the process. As I said, some of the private hospitals already managing positive patient in ICU and in the ward. So, but we try to coordinate in terms of how we can streamline the cases. So we hope that we can actually implement this by next week or so. By this Saturday, we have an engagement again. So this is our 3rd engagement with the private hospital in terms of looking to details and technical implementation and all the issues that they have, and we try to solve the issues and to coordinate the working at the ground level between public sector and the private sector.